City of Huntsville, and Wes Kelly, CEO of Huntsville Utilities. You will notice that we're sitting at least 6 feet apart according to CDC guidelines, as well as our own best practices to separate and sanitize. At this point, I will give a brief update on what the current numbers are, but before I do that, I will say that probably, as most of you know, there was some elevated numbers reported on the Department of Public Health's website yesterday that were elevated. That was due to some not accurate information, and that has been readjusted. We talked with ADPH today, and the current numbers that are showing are the correct numbers now, and that's what I'm going to give you. So, with that being said, there are 4,500 confirmed cases in the state of Alabama, 196 confirmed cases in Madison County, resulting in 4 confirmed deaths, and that is the correct information now. We continue to monitor that, and we will respond accordingly. So with that said, we will go to Dr. Pam Hudson from Crestwood Hospital.
Good afternoon. Thank you, Jeff. I'll say again what I said on Wednesday, I believe, and that is, so far, so good. Your community hospitals are maintaining a pretty stable census of patients that would be a combined either positive COVID test or persons under investigation, and that is very good news for our community and is a tribute to the very good work that everyone is doing to maintain social distancing, the masks, and the great hand washing, hygiene and contact cleaning. So keep up that good work. We are not out of the woods yet, although, as you know, there's been a lot of information being released about is it time to open up, and if we do open up, how do we open up our economy and our healthcare processes. So it does appear if we keep on the way we are, we would be eligible, at least under the federal recommendations, but that is going to be left here to our Alabama officials, our state Department of Public Health, and our local officials, and they'll be making those conclusions. I did want to mention today about your hospitals here. So far, we have not exceeded our capacity and our capability for taking care of both our community as well as the surge, or if you will, the number of cases that we have had in this community. And when I say capacity, I'm talking about bed capacity, intensive care unit capacity, ventilator capacity, and supplies. Undoubtedly, we've done lots of worrying and planning and scrambling to try to be sure that we could every day report to you that things are, that we have good plans and the ability to care for the community. But I want to reiterate that what you have seen on some of the national news about hospitals and seemingly a sea of patients on ventilators, that did not happen here. If you were to go into any of our intensive care units or even into our emergency departments where these patients are being cared for, it would look just like a routine day, except people are wearing personal protective equipment and have more isolation carts out so that you can don and doff your isolation equipment. So I just want to let you know that your hospitals are safe. We are here for you, and in fact, we are here for you because of the great work you all have done in the social distancing and all the other recommendations to stay separate and sanitize. A tremendous amount of planning and work has been done at hospitals and other health entities in our community to be prepared for our dual mandate going into the future. Dual mandate meaning be able to respond to any surge that we do have. As we get back to work, we can expect we'll have more cases as people come back together. But our other primary mandate is to take care of our community for all the other medical conditions and concerns that people have. We have all of your hospitals have emergency departments that are functioning 24 hours a day, 7 days a week, with the same staff, caring staff and competent staff that you have been used to being exposed to should you have needed us in the past. On the acute care side, we have other patients in the hospital who are in for other medical reasons and emergency emergency surgeries, and all that has been ongoing while we have prepared for our normal medical conditions, as well as the potential always over the next months will always be the potential for us to have a slight, hopefully minor spikes in our COVID or persons under investigation. We're in good shape from a personal protective equipment standpoint. We are in good shape here for testing. All your hospitals now have multiple sources to be able to test and get results back, and it seems every week we're able to we find a new test that will give results a little bit faster. So we're in good shape there. And at whatever point we were cleared, if you will, to restart elective surgeries, we will be ready. We've been working with our physicians. All the hospitals have for what is the safest way, again, for our dual mandate. Take care of this pandemic and the patients who get ill related to that, but also our very important work that is ongoing and must continue. Your doctors are also ready. Doctors' offices, and I guess I would stress at this point, this new normal is not the old normal. COVID is not watching its calendar and saying, oh, it's April 30th and now I'm gone. COVID is going to be out there going forward and for many months, and it will be risky to areas as we open up. We've got to mitigate those risks, and I feel confident that any plans that our city, that our county, that our state come up with and guidelines will be favorable to us being able to be successful. Again, I've said it before, if anybody can do this, this community can. So what you will notice in related to health care is you will be asked a few more questions when you come to the hospital, trying to identify, could you have COVID? Could you have been exposed to COVID? And if so, you'll still get the same great care. We just will make sure that you are in a place where we can use the correct personal protective equipment, and then if you aren't coming for something related to that, that we have you protected so that you don't get exposed to COVID while you're in the healthcare organization. And the hospitals have done a great job having separate areas. You'll also see masks on healthcare workers. That is just going to be the new norm. You're going to see them in the grocery store, but you'll see them 100% of the time in the hospital. Some of the things the other thing that you'll see continuing is limited, very restricted visiting. That is a very clear CDC recommendation that continue for several more months, at least through the first couple of phases. What you won't see, but is equally as important, is the special cleaning and additional care that we take in the hospital to be sure if we do have a patient who might have been exposed or who is positive for coronavirus, then we will be doing additional cleaning per CDC guidelines, and we'll be doing it every time. So that is, you won't see that. You will just witness perhaps we're a little slower than we might ordinarily be. And then the other thing you won't see is the undercurrent of us being very, very careful that we are prepared to react promptly to any uptick in cases in the community and be able to do that without anybody noticing a difference in the care that's being provided. We've been able to be proactive in this, so your hospitals are ready, but we've been able to be proactive and even anticipate some of the CDC guidelines. And the reason we have been able to do that has been because of the great work that our community has done in social distancing, masking, covering your cough, great hygiene. Don't stop. I will say again, so far so good, but we've got several more weeks of this, and then in the next months there'll be new guidelines that we'll have to, new habits to learn and new guidelines. So thank you very much on behalf of all your healthcare organizations. Jeff.
Thank you, Dr. Hudson. Now we'll go to Mayor Tommy Battle, City of Huntsville.
Thank you. Some of the numbers that we really need to look at, with 197 cases, active cases in the city, in the county, Madison County, right now. 197. If you look across the state, this is probably it's lower than, it's probably the seventh highest of all the groups. But Chambers County has 236 active cases. Jefferson County has 644 active cases. Mobile has 635. Shelby County has 245 active cases, and Lee County has 298 active cases. We have 197. So to the people out there, we have done a good job. You have done a good job. You have made it through this. You have stayed separated. You have stayed sanitized. But this is only the first half of the game. We have another half to go, and there's a lot more game to be played. So we cannot let up now. We're seeing a lot of people out there with fatigue. We're hearing reports of people getting together and having groups together. Let's not mess this up. We are one group gathering away from having a serious problem because one person who's infected who gets together with a group of 35 can add 35 to our count real quickly, and those 35 can add another 70 to the count. So we've got to continue to be careful, continue to sanitize, continue to separate, wear masks. The masks that we have right now, and we see most of our crew out here has masks on, these masks show that you are socially conscious and that you are socially responsible. Wear those masks when you're out in public, when you're getting close to other people, when you're in a position that you know that you'll have some people coming up and that you probably won't be able to control the 6-foot distancing around yourself. As we look to the future, April 30th, the Alabama Department of Public Health order ends on April 30th, May 1st. Everybody's kind of looking at that. Maybe that's the day that we start the process of opening up. In the process, let's really look at the process. The process will be a slow roll to opening businesses up and getting businesses back to where we were. We may never get back to where we were. We may be doing social distancing for a long time, but we have to recognize that, and we have to recognize that we're going to have to be careful. We cannot afford to let our guard down. We can't afford to have a resurgence. Resurgence puts us back in the same situation we're in today, and we can't afford to go back there. Our economy can't afford to go back there. So we're going to ask everybody to be socially responsible as we start to open up. There have been about half a dozen groups who have been advising the governor on how to reopen our industries as we reopen them. Yesterday, everybody saw the lieutenant governor had a press conference to advise the governor on how to reopen, and it caused some confusion out there. Lots of businesses were calling us saying, hey, we're getting ready to reopen. We heard the lieutenant governor's report out. We're ready to reopen. We're all giving those reports to the governor. We're asking the governor to look at them. Many of them have the same elements in them. Most of them have the same elements in them. Same elements of separation, the same elements of being careful, the same elements out there to make sure that as we go through this, that we're as sanitary as we can be, and that we still encourage businesses to be able to open, but open in a responsible way. The city of Huntsville and Madison County and the city of Madison will have a report which we will give to the governor how we think we ought to open, and it's going to be very similar to what the lieutenant governor gave. It's going to be very similar to what the House of Representatives members are going to present to the governor. But when we get finished, we're going to have one voice, and the one voice will be the governor's office, which will start us back to this road of recovery. Our new normal is going to include some separation in restaurants. It's going to be separation out as you go to the store and buy things in the retail stores. It's going to be new rules, as Dr. Hudson just told us about, new rules in the hospitals to keep visitors down. Nursing homes will have new rules. But, if you go through that full gamut of who's out there, we're going to have new rules on how we socially interact with other people. But it's good. It will keep us safe, and it'll keep us from having that resurgence. It'll keep us from going back into the position that we're in today. The people that are listening out there have done a great job. We have done a great job this first half making sure that we are probably one of the safest cities, counties, areas out there right now, and we have done a very good job, but we got to continue. We cannot let our guard down. We cannot have a resurgence. We can't go backwards. So thank you for the job that you're doing. Please consider it, and let's keep moving forward. Thank you.
Thank you, Mayor Battle. Now we'll go to Wes Kelly from Huntsville Utilities.
Thank you. Wes Kelly at Huntsville Utilities, and I'm very proud to represent the good men and women who work at Huntsville Utilities and are honored to serve City of Huntsville, City of Madison, and Madison County. During this unprecedented time, Huntsville Utilities continued to take steps to operate in our customers' best interest. Some of those steps include the suspension of disconnects for non-payment. So customers that are having trouble, we are sensitive to that trouble, and we've been able to hold off on disconnects since March 13th. That was the last date that we conducted a disconnect in our service area. Also, we have suspended penalties, so customers that ordinarily were paying late and there is a late fee associated with that, those late fees have also been forgiven. Matter of fact, I received a wonderful letter from a customer the other day, surprised that she paid the late fee and then found it as a credit on her next month's bill. So if you do pay the late fee, you're going to get that back as a credit on your next month's bill. And we're happy to do that because Huntsville Utilities just serves this community. We don't need to concern ourselves with the goings-on in other parts of the country, the state. We are here to serve Madison County, and it's our privilege to do so. Not just with payment programs, but also with reliability. We had a number of storms that have rolled through our service area in the last few weeks. There's some talk of some weather coming up tomorrow. But rest assured, Huntsville Utilities men and women are ready to stand up and do what needs to be done. Since the pandemic began and those storms rolled through, 18,000 customers have actually lost power. That was not a news item. Why? Because it was business as usual. We restored power. Now, we did it in a little different way. Our crews are spread out. We have staggered shifts. Maybe our PPE, we always have PPE in our line of work, but PPE is a little different now. We've got some additional PPE. So, matter of fact, didn't know they made flame retardant face masks, but they do. And our crews are getting them, and they're taking care of their business safely to protect both our crews and to take care of the customers and our responsibilities. We took other steps. We restricted access to our water treatment facilities. We restricted access to our dispatch facilities to make sure that those areas stay particularly safe and closed off. Our cleaning schedule, probably not hospital level, but very, very good. Electrostatic cleaners going through and cleaning our trucks, cleaning our tools, cleaning our facilities to make sure that our critical workers can do the work that they need to do and to do it safely. So we are concerned about this local economy, and we are working with our partner, the Tennessee Valley Authority, to help when it is ready to stand back up. We are considering programs to help industry when that time comes. What can we do as a power provider to make that financially as accommodating as possible? And we are also concerned about when these bills come due. One thing that we are doing a little unprecedented is Tennessee Valley Authority and Huntsville Utilities are together standing up a fund, a COVID-19 community care fund. We are putting $100,000 in as seed money for this care fund, and we're going to be asking community partners to stand with us to put money into that fund to help customers who are jobless, to help our shelters that need help. And right now, for many years, we've had Project Share, which helps those that are elderly or homebound handicapped. This will be a separate fund to help those that have lost their job during the COVID crisis and need help. So this $100,000 from TVA and Huntsville Utilities, I hope, is just a drop in the bucket. I hope the community is able to step up and help these people that need help. We are very good in this community of taking care of our friends and neighbors. We do it in normal days, and we definitely do it in times of crisis. So we are appreciative of the support that we've received from this community, and we'll continue to keep electric, water, and gas flowing. Thank you.
Thank you, Mr. Kelly. And thank you for watching today. We will be back here again on Monday, April 20th at noon for another briefing. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. Again, as you come to the microphone, please identify yourself and who you are affiliated with, and we'll allow one question and a follow-up.
Good afternoon. This is Dallas Parker with WHNT News 19. My first question is, we've seen a decent size increase in cases here in Madison County this week after a case rate had seemingly slowed down. Any indication on why, and was it the result of mobile testing or identified cluster of cases?
In Dallas, I might say that we really have not seen a very big increase in cases. Last Sunday, we were at 186. Monday, we were 187. Tuesday, 188. Wednesday, 191. Thursday, 194. Friday was 198, and today we're 197. We dropped back one. But we've really just seen 1, 2, and 3 cases a day added, and that's to be expected. I might let Dr. Hudson go to the medical reasons for that, but so far we have not seen an exorbitant increase in cases or much of an increase.
Keep in mind that the cases that we might see now, so someone that's ill who tests positive, those are the results of exposure a couple of weeks ago. So you would expect, with very effective social distancing and the stay-at-home order, you would expect us to stay flat or actually decrease, because some people are going to get well from this. So the number of cases that we actually have, in fact, we've been talking about trying to get a daily report to be able to see, instead of that cumulative count, more of a, what's happening on a day-to-day basis. And I think you'll see some shift in that as we move out of this initial containment process and into different ways to look at the data to tell us how we're doing. Instead of having to do the subtraction. Okay, yesterday it was whatever, but that's, remember that everything is, you pay the price a couple of weeks after the indiscretion.
Understood. My follow-up is just COVID-19 is projected to peak in the state in a few days. Can you explain what that means and what it could mean for everyday life here in the state and in Madison County?
We hope in Madison County it won't mean anything other than we have flattened the curve. There are other parts of our state that are in the midst of peaking, and it is our hearts go out to those communities, and understanding with all the preparation we've done and not had that surge. As I've said many times, I do not want to be a hotspot here in Madison County. And everything we've done and that the community has done to make sure that that doesn't happen is, again, we're not ready to say all is well, but so far so good, and we hope everybody will keep it up.
I'm Casey Alberton with Way 31 News, and my question is for Wes. So have you guys had any cases of COVID-19 among your employees at Huntsville Utilities?
Yes, we have one positive case, and that employee, of course, was sent home when he first started not to feel well, went to the doctor, went through the testing program, and that employee's not been to work in well over a week. And a matter of fact, all of his crew members were also sent home.
Okay. A follow-up question for that. I know you said that coronavirus has affected how you guys respond to power outages. Do you think it's affecting the timeliness of getting power back up?
No, luckily it is not. We have a very well-run routine for getting the power back on, and that typically happens in 2 or 3 men groups. And so that sort of lends itself towards separating in any case. So it is business as usual when it comes to power restoration.
Thank you.
At this point, we'll conclude the press conference. Thank you.
Good job, Wes. Man.
So you were just hearing from some Madison and Huntsville city leaders. What we know now is that there were some elevated numbers reported from the Department of Health due to the inaccurate information. So if you checked them yesterday, they may be different today. The current numbers are correct right now. 4,500 confirmed cases in Alabama, 196 confirmed cases in Madison County. 4 confirmed deaths so far. So that is the correct information if you're keeping up to date on the Alabama Department of Health's website. Dr. Pam Hudson says so far so good when it comes to hospitals here in Huntsville. She says they are holding up. They have not exceeded capacity when it comes to bed, ventilator supplies. She also discussed what the Crestwood will look like during a new normal. You'll be asked a few more questions coming to the hospital. Doctors, nurses will be wearing more face shields. We also heard from Mayor Tommy Battle. He discussed reopening of businesses, what will happen once that stay-at-home order does expire April 30th. He said City of Madison and Huntsville are giving the governor a report on how they feel businesses should reopen, but as it is up to the governor's office to make that final decision on what that reopening process will look like. But of course, we're going to have more on all of this on Way 31 News at 5. Until then, we'll get you the latest information on our website at waytv.com. We'll send it back now to your regular programming.